with the coils and with the pulse generator that creates the pulses for the coil. And what the patient will do is take the coils and place them on top of the head in such a way that those coils we're seeing here are activating particular parts of the brain.
It's like you're these two persons, the one person out here looking at yourself saying, pull yourself together, and then yourself who is actually really, really trying but can't. So there's this immense inner fight about, this is not difficult, you can do it, and then there's other parts that, well, maybe, but I can't. Life just extremely complicated when you're depressed, and you can't, and which actually leaves you kind of motionless and stunned, numb.
The way it activates the brain is that the electrical impulses will affect the small capillaries, the small blood vessels in the brain. And one thing is that it can induce formation of new capillaries. After being treated with this medical device for 30 minutes, after 7 days, most of the patients have a feeling of having an improved mood. They will score much better on a depression scale.
How does this compare to electroconvulsive therapy, which is extremely controversial because people think that ECT damages the brain perhaps in the long term and changes personalities? Are you working on the same principle as this or not?
Let me emphasize that this device imposes extremely small electrical pulses on the brain, so small that the patient cannot sense when the patient is treated. And ECT are huge electrical fields that are imposed on the brain, causing memory loss, etc. And it's a totally different technology. It has nothing to do with ECT.